Dr. Witkowski was a very interesting patient who presented with a bleed in his brain. And it was a special kind of bleed. It wasn't a bleed within the tissue of the brain. It was a bleed into the spinal fluid space around the brain where the blood vessels that feed the brain live. And his abnormal blood vessel or abnormal pipe to the brain was in the back of the brain on the vertebral artery. And the interesting thing about the vertebral artery is that you have a vertebral artery on both sides that merge together to form one pipe called the basilar artery. And his abnormality was only in one of the branches that formed that main pipe. So the procedure was to block off the pipe that fed the back of the brain so that it wouldn't bleed anymore. So if you look at patients who suffer a bleed in the brain like his, a half of them die, and of the half that live, about a quarter of them do well, and the rest of them just do okay. So you might imagine that the way you care for the patient after the surgery has a great effect on the patient's outcome. We're lucky enough in the Catholic health system to have the only neurocritical care fellowship in the region, and as a result we have some of the finest neurocritical care intensivists in the region, and that certainly had a tremendous effect on the patient's outcome and his ability to return to normal activity.
Well, the road to recovery for Tom was, first of all, is getting control of the current situation. Then finding out what caused the current situation, fixing that problem. So that means taking care of a man who's in deep coma. That means diagnosing the cause of it, fixing the aneurysm that we found, and then seeing can we get back as much function as possible. Once the original damage happens, what can we do to save the rest of the brain?
I came in the following day, and I was unable to talk to him to do a preliminary evaluation on him, initial discharge interview, and I spoke to his sister. So his sister went on and told me how he was a professor at Buff State. She told me that he was part of Chopin Singing Society and the Amherst Symphony. So we started talking. So I incorporated that right away in my plan of care. I felt it very important to tell the story, and I usually tell the story of a patient. So it's not just that stroke that we're caring for, it's that patient, that Mr. Witkowski, who is a professor at Buff State.
By luck, Potsdam A Cappella Group was here. They couldn't make it to their original destination, and knowing that Dr. Witkowski was a music conductor, the nurses took it upon ourselves to go and take him down to the lobby to listen to this group. When Dr. Witkowski was taken down, he closed his eyes and he started to tilt his head, listening to the music. He was not very responsive prior to that, so to see him just close his eyes and use the imagery as the singers were performing, it was pretty amazing. We were very excited to have the opportunity, and we did invite the group up to sing in the entire unit because he had just kind of stayed to himself, wasn't really responsive. We weren't sure how his recovery was going to be. So to see the change in him really made a difference in how we treated him. Dr. Witkowski, when we found out that he was a music conductor, it was noted in all of his records. And here at Mercy Hospital, we have a basic music station that plays through. So that wasn't really working for him. Once we realized that he really responded well to that a cappella group, it was discussed in his care plan to add additional music therapies for him, and it really made a difference in his recovery.
As we moved on and he was now ready for the next step, he was needing to go to the next level, no more critical care, We then brought him down to the 5th floor. We introduced the staff to Dr. Wachowski, and we also incorporated that, and we told them in our plan of care that this was part of the plan of care as music. So they continued that, and he continued to progress and progress and progress.
It is unusual to have someone regain as much function as he did. Usually the outcomes are not quite as good because once you've bled in the brain, which is a form of stroke, you're left with residual deficits. In his case, he was extremely fortunate, and the fact that he was able to return to his music career is really outstanding and a testament to the treatment that he received here at Catholic Health System.
I learned that music had been part of my therapy only afterwards, when people were telling me the types of things that had gone on while I was in the ICU. The daughter of one of the hospital employees plays the violin, and she came in and played violin for me while I was in the ICU. Months later, I met a woman who had come to visit me the day after Christmas and sang me Polish Christmas carols when I was in the ICU. One of my other friends told me that a doctor had come in at one point and on his cell phone had played for me Beethoven's Fifth Symphony, had found it, put it up to my ear, and played it for me. And so I'm listening to this music to keep me occupied. And at first it was, oh, this is so beautiful, this is so beautiful. And after a few days of that, came the realization to me that this is so beautiful, I'm not ready to give it up yet. My caregivers they became like a second family to me. They helped me fill in the blanks of my life. They were very supportive. They knew what I had been going through. They were pushy, but in a nice way. And they knew when I had reached my limit. I was trying really, really hard to work my way through it all. And they would help me move at my own pace. So to be here now doing this is, to me, it's a second life. It is a miracle for me to be here.